let's talk about the one nutrient that can completely transform your absorption of your thyroid meds for the better. And you know what? I'm not going to wait till the end to tell you. It's vitamin C. I'm going to share what the studies have shown, which is really amazing. And I'm also going to share my favorite vitamin C supplement, one that not only can help with thyroid med absorption, but will also help your adrenals, which is really important for those of us that have had their thyroid removed or have been diagnosed or have a thyroid disorder, and a supplement that I've seen really great results with in my life and in my clients. Those that I have put on it throughout the years have seen really great results on this supplement and feel amazing, especially with their energy. But let's talk about why you might have an issue with absorbing your thyroid meds. When we're looking at thyroid meds, especially T3, you've got to understand how important T3 is. A lot of you guys are not getting T3 tested or don't even realize that this important hormone is not being tested. Please, if you haven't already, get my Thyroid Lab ebook. I'm putting a link in the notes so that you can go get it and understand how important it is not only to get a full, complete thyroid panel, but there's other lab markers that are going to be super important to look at when you're looking at your thyroid hormones. Well, T3 is active thyroid, right? It's what binds to the cell. It's what allows the cell to have the energy it needs to do everything it needs to do at the different tissue levels, right? But when you don't have enough T3, and I'm not just talking about outside of medical ranges, I'm talking about even being low on medical ranges. I see a lot of people that are in the twos when it comes to free T3. And these are ranges here in America. I know a lot of you guys might be listening in another country, but looking at your medical range, wherever you're at, and if you're seeing it on the bottom end, like that bottom quarter of that medical range, you could probably have those hypothyroid symptoms and not even realize it because your doctor tells you that everything's fine. But even when you're suboptimal on those medical ranges, you're outside of the functional ranges, that affects your body's ability to function optimally. Things slow down. And a really big area that can slow down is your digestive system, your stomach, your liver, your bile production, HCl production, enzyme, movement throughout the colon. And the thing that's frustrating about this is that oftentimes, if you have your thyroid removed or you've been on thyroid meds or have a thyroid disorder, you're going to an endocrinologist, right? So they're going to focus on endocrinology, but doesn't really most of the time talk to you about how it affects different areas in your body. So you might be having all these other issues going on and not realizing that connection between those hormones and what you have going on. Now, with the digestive system, when it starts slowing down, you start creating an environment where absorption and utilization goes down, where gut microbiome is disrupted. You can create pathogens like small intestinal bowel overgrowth, bacterial overgrowth, not bowel overgrowth, small intestinal bacterial overgrowth, fungal overgrowth like candida. You can see H. pylori and parasites because your digestive system is not optimal. The terrain, the environment is now disrupted because you don't have enough T3. We see that over and over again in studies how T3 can affect the digestive system. So without even realizing it, creating gut issues. Now, sometimes for those of you guys healing post-thyroidectomy or on thyroid meds, been diagnosed with a thyroid disorder or think you might have a thyroid disorder, you might have the symptoms of a GI issue like, acid reflux or bloating, skin issues like pain in your joints. You might feel like you're not going as often, like having bowel movements, or when you do have bowel movements, you're not fully emptying. You might have all those symptoms, or you might not have the GI symptoms, even though you have a GI issue. You might have things like low iron, low ferritin, low B12, low B9, anemia, your mineral status is disrupted because you're not fully absorbing, breaking down the nutrients you're getting from your food. And for a lot of you guys, you don't know you have these issues unless you're testing it, which is why, again, getting a complete wellness panel is really important, especially when you're getting your thyroid labs done. And again, you can get that at the link in my notes. And just a side note, sometimes you guys are like, my doctor won't order it. My doctor says this is not important. Okay, well, that's why you're still where you're at. Go get your own labs. You can either find another practitioner that will order the labs you need, or I also have an option on my website for you to go in and order your own labs. Whatever you're missing, if you need the complete wellness panel, you can order it on your own. In fact, I had to do that a period of time when I was a patient before I became a doctor. You shouldn't allow a doctor's just refusal to go deeper on testing to affect your quality of life. Get the work you need, get the labs you need. But going back to the gut, now, what ends up happening when it comes to thyroid meds is that if you're not absorbing and utilizing it, what ends up happening, and what I've seen a lot throughout the years, is that people will either be on too much, like a lot, not too much, they'll be on a lot, like a high dose of meds. That is if their doctor's willing to take them there, right? They're on a lot of meds, but they're okay within range. Sometimes they're not even optimal. Like, how are you on so many, like so much meds? Like the dosing is so high and you're not out of range. It's because you're not absorbing it. You're not utilizing it. And this comes up often in thyroid med studies is the absorption of thyroid meds. But a lot of you guys have doctors that aren't willing to go high up in that dose, and you're stuck on a low dose and you're not fully absorbing it. You don't want to be in that situation. In the end, I'm going to share with you guys what these studies say about vitamin C. But in the end, you want to, once you get those thyroid hormone levels optimal, you want to go deeper on how to heal your gut, how to get back into replenishing all that good bacteria. So if that's you and you're like, man, I need to make sure that I get my gut health in check and make sure I'm optimizing it because I've had this history with thyroid hormone issues. Make sure to subscribe to this YouTube page. Make sure to subscribe to my podcast. And if you want my help, go to drrebeccawarren.com. But going back to what you can do to help. Again, a lot of you guys are concerned, rightfully so, that you are absorbing your meds. I get that asked a lot. A lot of you guys talk to me, my coaching clients, my inner circle community, talk to me about how, okay, I keep it away from foods. I keep it away from this. You should absolutely keep it away from coffee. Studies show that coffee can decrease the absorption of your thyroid meds. Don't worry, I was really bummed to hear that because for a long time, I took my meds with coffee. Not a good thing. But this is one way to increase and to ensure that you're getting the most out of your thyroid meds. And it's something as simple as vitamin C. Okay, the first study, we're going to look at the first study that was titled The Effect of Vitamin C on the Absorption of Levothyroxine in Patients with Hypothyroidism and Gastritis. It was in the Journal of Clinical Endocrinology and Metabolism. Now, in this study, I thought this study was really unique because when you come across a lot of thyroid studies, you don't see a lot of studies that look at TSH, T4, and T3. A lot of them just look at TSH. You're lucky if you see T4. So it's really cool to see how even taking vitamin C with your meds can affect the active thyroid hormone. So in this study, they looked at 31 patients. And in this particular study, they did have gastritis. They had inflammation, which again, I cannot tell you guys how many times I have discovered gut issues in clients that have had a history of thyroid issues or thyroid removal, and they had no idea. So, but in this study, what they did is they had participants take T4 tablets with a dose of vitamin C, 500 milligrams of vitamin C every day. Then the researchers measured those thyroid levels at 2, 4, and 6 months. So what they found in this study is that TSH levels decreased significantly in all the patients, with the average being 69.2% and normalized their levels in 54.8%. I want to make a note because the authors in the discussion made they made a point to say, listen, in this study, the dosing did not change. The only thing that changed in this study was the utilization of vitamin C. So they said, we have demonstrated an improvement in circulating concentrations of TSH, free T4, and T3 by vitamin C in patients utilizing T4 replacement. It is possible that some patients may not have been on enough thyroid meds before receiving vitamin C, but because the dose was not changed throughout the study, the change induced by vitamin C is valid, okay? Free T3 and free T4 levels increase significantly in almost all the patients. And even more interesting, I thought this was interesting, the fact is that the TSH and free T4 did not return to control 2 months after discontinuing the vitamin C, suggests a residual effect of the vitamin C. So even 2 months after stopping this, they they still saw positive effects. Now, I think like the study doesn't go into like why all these amazing changes within vitamin C. Well, vitamin C is such an important nutrient and it's utilized. Your body utilizes it, especially when you're ill and in times of stress. And stress is stress. So being suboptimal thyroid hormones, going through surgery, having autoimmune antibodies, like that's the stressors associated with thyroid hormones. We're not even talking about stressors if you have other comorbidities like sex hormone issues, if your body's inflamed, or if you're stressed out with work, or if it's a stressful season and you're traveling a lot. Like stress is stress. And when we utilize that vitamin C at higher levels, we need to replenish it at higher levels. And most of the times we don't. Vitamin C is great for the immune system. You know that. Vitamin C, I say you know that because that's usually where I hear most people say vitamin C is when they're not feeling well. Vitamin C for the adrenals is really, really important. Vitamin C as an antioxidant to protect your cells from free radicals. It's so vitally important. So I truly believe that these participants were probably not only seeing a great change within the gut and the absorption, but their body was probably really needing this vitamin C throughout. And that changes the body, right? The second study, this one was out of Argentina, and it says vitamin C improves the apparent absorption of levothyroxine in a subset of patients receiving hormones for primary hypothyroidism. In this study, they didn't specifically look at people with confirmed GI issues. They just looked at thyroid patients that were hypothyroid. And in this study, they achieved similar results in the study conducted on 28 patients with elevated TSH, despite being on T4 dose higher than 1.7. So these participants were on a good amount of thyroid meds. What did I say? I saw that over and over again, right? When I would work with people that weren't absorbing their meds as needing higher amounts of T4, than their body was using, right? Because their body wasn't using it efficiently. So researchers asked patients to take T4 tablets with 1 gram of vitamin C, and it was dissolved in water for 6 to 8 weeks. And in this study, they found a significant decrease in serum TSH level, and it was observed afterwards. All right, this is really cool. Looking at how our body, when it's lacking something and we give it what it needs, how it can change and work and function for the better. So, vitamin C increasing absorption of meds. And I know, again, for a lot of you guys that are dependent on thyroid meds, had your thyroid removed, you've been on it for a really, really long time. I did make a note about this in my last podcast episode about thyroid antibodies. Thyroid antibodies destroys the thyroid. If you didn't know what to do or you weren't told you had Hashimoto's, when you destroy the thyroid at a cellular level, the tissue, you become dependent on thyroid meds. So being able to absorb and utilize your thyroid meds for a lot of you guys is life and death, right? Life or death. It is quality of life, not just dying, but the quality of your life is affected. So my favorite vitamin C supplement, because I always get asked about supplements, is Jigsaw Adrenal Cocktail. Now, I'm going to put a link to it so you guys can check it out. And if you use Thyroidless Life, Thyroid, LESS, Life, like the podcast and my YouTube channel, you get $10 off your order. Now, the reason why I utilize adrenal cocktails, because I like to get for a bang for my buck, right? That's the saying, right? Bang for my buck. And what I like to do, I use this on a lot of my coaching clients in my Thyroid Inner Circle community, is I want to see how we can not just support the thyroid, but support different systems in our bodies. Now, if you've heard about the adrenal cocktail, it is a recipe. It utilizes vitamin C, cream of tartar, and salt. But I noticed that, especially with low T3, it can be hard for you to utilize and burn up carbs. You can have more inflammation. You can have insulin. So I didn't like having people spiking their glucose and insulin multiple times a day because I would have people take the adrenal cocktail multiple times a day. So in this adrenal cocktail, you have a whole food source of vitamin C, very bioavailable. You have potassium, which increases the absorption of vitamin C and utilization for the adrenals. And then you have sodium, which is from Redmond's salt, one of my favorite sources of salt. So it even has more minerals and nutrients, not just sodium. So utilizing the adrenal cocktail has extra added nutrients that should not affect your thyroid meds, but will support your adrenals, helping to regulate and replenish that cortisol. And again, when you don't have optimal thyroid hormones, your adrenals are affected. And so that's why I decided to go from just a really bioavailable powdered vitamin C to the Jigsaw adrenal cocktail and try it out. I think this is such a simple, easy thing that you can implement into your daily practice to help your immune system, to help your adrenals, to help inflammation in your body, and apparently now help with absorption of your thyroid meds. Again, I'll put that link there. Thyroid List Life is the promo code. But let me know if you guys try it, what you think about it, if you see changes over time. Obviously, give yourself a few weeks to a few months to see your body respond. And the last thing I'm going to say, the reason why I'm giving you my favorite supplement finally, I'm going to start sharing my supplements with you guys, is because if you buy cheap supplements, you get cheap supplements. And, your health is an investment. And I understand what it's like for a lot of you guys to buy things to make yourself better. And it sucks to buy things that don't work or they're not great quality and you don't know it. So invest in your health, but invest in the things that you can see changes with over time.